on research, focus on research a lot more, and also come up with help in coming up with data and evidence. It was very encouraging. I think some of the students already said in their thesis, they will be focusing on AMR. So that's a very good starting step to at least make sure that we do have data, because without data, even influencing the policymakers becomes a key challenge. So that would be very important. So I think just to wrap up last week's session, the key message that was coming out is we do know enough that warrants us to act. And the hope lies with the youth, the hope lies with the students to at least make the changes that we would want to see. So without wasting much time, I will quickly introduce before I introduce the next, our key speaker for today, who's Dr. Emmanuel. I will go through, I will invite our director, Dr. Mefin Pundu, to just give some very few opening remarks, and then I will introduce our keynote speaker for today. After he finishes his presentation, we'll take a few questions. So as the presentations are going on, kindly utilize the chat to put any comments, any questions that you have. And following the presentation, we'll also have breakout group discussions. We do have 6 questions, so you automatically be assigned into the breakout groups. My colleague Musonda is actually helping us doing that now as we go through the sessions. So over to you, Dr. Mefin. Thank you.
Yeah, thank you so much for the this program that that has focused on creating leaders in the tertiary institutions, which is one of our flagship programs. Just I think to introduce a little bit to Dr. Kavadi, it's been quite encouraging looking at the past few weeks, the topics and the subject matters that have been discussed, the way that your discussion groups have been going. The whole intent, I think one of the things that we wanted to do, I mean, out of the many students in Africa that applied, we were able to select you guys as the cream of that group, and we have tackled quite a number of subjects, from just understanding what AMR is, getting into the policy arena that has looked at the global action plan, the national action plans, and we have also focused on issues of looking at where your role really is. We've looked at the challenges, we've looked at the opportunities, and we've also really challenged you, but you've equally challenged us. I mean, really, some of you are doing enormous and great work in the universities that you are in, and also in the communities. I think the starting video was again very interesting. I mean, showing us that, you know, when we talk about the bacteria, when we talk about the viruses, when we talk about, I mean, the parasites, when we talk about these protozoas and the way that they have been able to fight back, and we see that with COVID, how they continue to mutate, the same way that really antimicrobials have been mutating generally to actually beat us on this game. And I think you play a critical role. And one of the things that we'd like to see ultimately out of this program is that truly you are equipped as champions that will go out beginning now. And I mean, take up these challenges in your institutions, in your communities, and start making a difference and start coming up with innovative ways that raises data that practically will be able to show our policymakers, our program managers, our communities to change the way that we behave towards the use of antimicrobials. And we are privileged, actually, the bacteria were telling us, I mean, how smart they are and how much that they actually understand that, this is a One Health issue. They are responding to environmental challenges that, we create as humans. They are responding to the challenges in the planetary health, in the animal health, in human health, and basically capitalizing on the mistakes that we have been making and telling us, oh, fellows, we are a step ahead. If you cannot do anything and really have a paradigm shift in the way that you address this issue, then, we're going to beat you. We'll clear you. And when we look at numbers of the people that die in the human health out of really antimicrobial resistance, it's a threatening number. But can you imagine also the number of the animals that die, I mean, from AMR, the planetary health and plants that we destroy because of AMR, the environment that we are destroying. We don't focus much on these areas. We focus on, on the 10 million that will be dying by 2050, and all those numbers, but we don't look at the other sectors and the impact in the other sectors. And I think this is where really experts and friends of ours like Dr. Emmanuel Cavalli comes in to again give us a sense of balance and the sense of saying that, it's not just in one area where we have these challenges and where we are making a mistake, but there are these other areas under the One Health banner, and our approach in addressing AMR must be multi-pronged, that that considers this One Health approach, and so that we can actually be able to contend and hopefully win the battle against our partners or friends, the microbes that we need to coexist, but at the same time not giving them the advantage of destroying us. Yeah, so with that, again, I just want to say, thank you so much for your commitment. Each and every week we see, you are all there, and this is very exciting. I think it's an exciting program, and we know that you are the keys and agents of change. We've seen that in the political arena. We've seen that when you have fought these political issues. We have seen that, I mean, when students have responded, they've been able to bring up a lot of change, and you are key agents. So I think with that, it is my honor, really, and pleasure to just really invite Dr. Cavalli, who Julian is going to introduce to us, and I look forward to listening to him and the further discussions and dialogue. And in the discussions, we encourage you to actively participate and to actually, on this issue, and so that, you are well equipped, that as you are working in various universities across Africa, but also when you have graduated, that you will be able to actually continue working around AMR. And I think with those few words, I just want to thank everyone, for the time that you have taken, your commitment, and we look forward to an exciting day and presentation, including discussions that will follow. Thank you so much, and thank you, Julian, for your relentless work, and Musonda, in ensuring that these meetings are taking place every Saturday, which I know it's taking away from your weekend, but your attendance is very, very encouraging to us, and your commitment. So thank you so much, and wishing us a very great and good deliberation, and the session today, that we can look forward to it and say, we again have learned a lot of things that we can take up. So thank you so much. I'll hand over back to Julian.
Thank you so much, Dr. Murphy, for inspiring the students. And it's always encouraging, for sure, to see them logging in every time, having motivated students like Daniel, who's always helping as well. So without wasting much time, I will introduce our speaker, Dr. Emmanuel Kabali, who is the AMR Project Coordination and Technical Support Consultant at the Food Systems and Food Safety Division of the Food and Agriculture Organization of the United Nations, FAO. He's currently based in Rome, Italy. Thank you for joining. I know you're, I think, an hour before the East African time, so thank you for making time for this. And Dr. Emmanuel has coordinated before the FAO Southern African component of the AMR project that's supported by the Fleming Fund, covering activities in various African countries with a focus on implementation of the Global Action Plan in the food and agricultural sectors, guided by the FAO Action Plan on AMR and applying the One Health approach. He has supported countries in costing their national action plans and also developing national AMR surveillance plans. He has previously worked as a veterinary surgeon for large animal and wildlife medicine, and also as a pharmaceutical inspector and quality assurance manager at the Zambia Medicines Regulatory Authority. Dr. Emmanuel, as Dr. Murphy has said, has supported REACT Africa in a number of activities and has been a key speaker in some of our annual REACT Africa conferences. So thank you so much, and over to you, Dr. Emmanuel.
Thank you very much, Julian, for that very good introduction. I didn't know that there's a bit to speak about me, so I'm grateful. I'm going to try and share my screen and kindly confirm you can see my screen. Are you able to see my screen?
Yes, we can see it. You can go ahead. Thank you.
Thank you very much. So just to add to your introduction, yes, I've worked on the Fleming Fund project, initially in Southern Africa. And now I actually coordinate the same project at FAO at global level. So I'm basically doing the same thing, just a little bit more with a bit more headache and responsibility. And as a continuation of those headaches and responsibility, it's been very difficult to prepare a presentation to this a group of young people, because I know they've been listening for weeks, and they've been listening from great people like Dr. Mpundu, who knows much more about this topic. So my worry was, what do I say? And this is the challenge we have during these COVID days. Having meetings where we don't meet in person, you really speak to a box, a computer in front of you. How do I prepare a presentation that is going to inspire the minds that are on the other side without really repeating what has already been said? So I thought I'll probably have a motivational a talk for the next 15 minutes or so to colleagues, to young colleagues. And I tried not to go into definitions and giving you content and substance, because I know for certain Murphy and other colleagues have really told you everything about AMR. You already know what is there to know. And Julian said, moving from paper to action. And I think that's very important. So I'll try to, in a nutshell, define then take most of my time talking about One Health, not a definition, but from a practical perspective. And it's one view of the many different views that we can have on One Health. And then I'll try to motivate for why you colleagues should take action and take that action now. So I hope I will not bore you. We know these guys. We saw them in the video. The video did half of my presentation already in less than a minute. But these guys are serious about what they're doing. And we are noticing more and more that treatment, curative care is becoming less and less effective. And that is antimicrobial resistance. So your concern as an intellectual, as a future leader, as a future doctor, and as a future professional in your area of expertise is that we are likely going to see this situation getting worse and worse unless we do something and do something now. And antimicrobial resistance is very critical to all of us. A practical question, well, before I move to the practical question, you need to view antimicrobial resistance not as a health issue, not as a medical issue. I'm both veterinarian, pathologist, pharmacist, and now a global leader in my area of work. I learn every day that antimicrobial resistance is not only a health issue or a medicine issue, because health in itself is very wide and diverse and dynamic. So we talk about one area, difficult to explain, but it has actually far-reaching consequences. And that is the most important point. So I ask you, colleagues, and what you should come out of this discussion with is, who is responsible for your health? Who is responsible for your health? That is a personal question. Because when we talk of global action plans, national action plans, those are huge, complex issues. When we define antimicrobial resistance as when bacteria, when microbes, that is still a very big, vague issue. Who is responsible for your health is very personal. And I think we should all take antimicrobial resistance very personal. We should take One Health very, very personal. And the One Health approach, therefore, is very personal. So who is responsible for your health? Health, of course, is multifaceted. It's multifactorial. There are several elements to health: individual health versus public health. Public health itself versus community health. And I would like you to take note of these words because you are students, so you can go and investigate. But these are all loaded and potent statements. And my goal now is to see a transition within our lifetime, a successful transition from curative care through preventive medicine and ultimately to predictive medicine. So curative care, preventive medicine, predictive medicine. These are all potent terms. If you have a pen and a paper, take note of these 7 phrases that I've used in this slide, because this is really where the crux of One Health approach lies: individual health, public health, community health, curative care, preventive medicine, predictive medicine, and the transition across. Who is responsible for your health? And I'll not give you an answer to that. You should be able to provide that answer, if not at the end of today's session, at the end of this entire program. And that will give you a better understanding of why the One Health approach is important. Moving forward, what is our current situation in terms of the One Health approach? Again, I'm not going to define what the One Health approach is, unfortunately. And I was doing this in the assumption that someone might have mentioned it and might have defined it. But over the years, over the hundreds and hundreds of years, what we are seeing now, the major part of the current phenomenon is that urbanization has become the core of our existence as human beings. And what we are now seeing is the emergence of mega cities, huge cities. And if you look at the map in front of us here, I hope you're seeing my screen, you can see that Africa is a bit behind. And you colleagues usually will see this as a bad thing. Usually we are told Africa is backward, or Africa is still developing. Most parts of Africa are still developing. I'm a philosopher in that respect, and I wouldn't want to take us through what my thoughts are, because I believe Africa is way ahead of the world, because we had mega cities tens of thousands of years back. And if you're a person of faith and religion, that is hard for you to fathom, but it's clear, it's a fact. If you look at the pyramids, which are current civilization of Africa, there was something that really was happening in Africa, but we are past that stage. We've gone through regeneration, we've gone through several full cycles, and we are starting up again. So we look like we are coming from behind. But in places like Europe, the US, South America, and most potently, Asia, the large part of Asia, these mega cities have got millions, tens of millions of people. I've been to several places in Asia. I've been to Beijing, 28 million people as at 2013, 2014. Tokyo, 15 million people. And these are very small spaces occupied by so many people, so many great minds. That is a critical component of the dynamic of today, the developed world. And it is projected that by 2030, 60% of the entire world population will be in mega cities. What that means, colleagues, is that we are shifting from the rest of the world to about 1% of the land mass, and we are all going to stay there. We are packing ourselves there. Unfortunately, there are dynamics at play there. While this is happening, here is exactly what happens, is that the interface is clear. The divide is very clear. You have people packed in high-rise buildings, and those are very expensive locations, and you spend a large percentage of your earnings affording those locations, and you spend a large percentage of your time staying in those locations. On the other side, there are people that are not fortunate, and that's the majority. And they spend most of their time in the areas that are in the foreground. In Africa, we call these compounds, we call these shanties, we call these slums. And I know Kenya has one of the largest slums in Africa. South Africa has a very potent place, Soweto, and a few other places, Kailisha. But this is part of the social ecological dynamic. There's change here. We are creating a new dynamic every day. And this brings a complexity to how health is delivered, how vulnerable we are, how safe we are. If you zero into a slum and you see there are several pressures there that are going on. We have environmental and public health impacts due to pressures on basic infrastructure, water and sanitation. Colleagues, you all know, not all of us come from privileged homes. We all come from a place of lack in one way or the other. And when we are failing to deliver or to receive in this case, because we are young people and young people are very radical in that we know our systems are failing to deliver these services. They are failing to deliver water. Food is hard to get. Sanitation, toilet facilities, waste management facilities, pest control, vermin control, rats and cockroaches and all those. And they're also, pests are also changing and innovating. You know, it's very hard to destroy cockroaches in your house now. It's very hard to get rid of those rats in your home. Why? They are also becoming resistant. So it is a huge dynamic. And I chose to take this approach from the conventional approach. I would relatively just go and talk about food and agriculture. But I took this approach because you are the leaders of now, and you're carrying the future of Africa in you. Because 20 years from now, I will probably be old and gray, You will be full of energy, you have the children, and your children will be depending on you, and you have a message to carry to them so that they can carry the future. So basically, you are carrying the future of Africa. But again, when you look at the projection in the next 20 years, Africa is going to be the center of the world. Again, the world will depend on Africa, not only for resource, but for minds like you to offer them solutions. And because of that, then I am actually speaking to the future. And especially that you are the cream, Dr. Mpundu said. You guys are the cream among the applicants to this program. So what is my message to the future? I'm not going to bore you with better production system, better agriculture system, and those things that are really paper. I'm going to ask you very practical questions. I used this slide some 7 years ago, and we're trying to map how a super bag, the NDM1, New Delhi metallobeta lactamase bacteria spread. It is New Delhi because it originated in India. But if you look at, and this is a very complex picture to follow, the first detected case was detected in Sweden around 2008. And this is because someone traveled from New Delhi to Sweden. And in just 4 years, this gene or this bacteria with this gene was detected everywhere in the world, including Greenland, the very cold areas of the world. In 4 years, a very resistant gene spread in the world. And this is not just because of misuse of antibiotics in human health. Definitely not. It's definitely a very complex problem that we are faced with. And this is some 8 years ago. Today, we are in a COVID pandemic, and it's less than 1.5 years. And this pandemic has spread across the whole world. So even the 4 years projection that we made is being defied by COVID-19, because COVID demonstrates clearly that infection can spread around the world several times over and over in a very short period of time. We have several variants that have started in one place and they've ended up everywhere in the world. So what is really happening? The concept is One Health. Everything is connected. I am in food and agriculture. I'm specifically a veterinarian. I'm also a pharmacist. So I'm responsible not only for the health of animals, but also the quality of the products that we use, both for human and for animal treatment, curative treatment. But the system is so interconnected. And our friends, like Mefin called them, the bags, are not waiting for you and me. They don't have to get a degree. All they have to do is spread and spread and spread, multiply and multiply and multiply. And because we are so interconnected, we are not smart enough to fight this battle right now. Myself, my generation, and those ahead of me, Mefin and other colleagues, we are too late. We are behind. The only hope we have is you. We've written national action plans, but we are so slow in prioritizing, implementing them, because we have other pressures, political pressures, military security, and other issues. In food, we need to feed the whole world, and yet half the food that we are producing is being wasted. So we are not that smart. We hope you are smarter than us, and that you will offer the world more comprehensive solutions, that you will give the world much better answers. And the first question I would want you to answer is, how wide is your imagination? How diverse are your plans? How ambitious are you as a young person? If you're studying as a pharmacist, are you going to come and join us pharmacists in a silo where we prevent others from touching the sacred medicines because they are not pharmacists? Or if you're a medical doctor, are you going to say, I'll reign supreme and everyone else works for me? I know everything. Because the truth is, we don't know the answers. Here is an excerpt from the current FAO action plan. The focus is 5 areas. It's the same 5 areas in the global action plan. It's basically the same thing that we are saying. But are we doing enough about it to actually make a difference? Are we bringing enough people on board to make a difference? Here is key areas that we are taking action in the countries. We know we've been told multi-sectoral engagement, multi-sectoral action, national action plan, sub-national focus and ownership of these actions, having core targets that can be implemented and that can be impactful. But are we doing something? The biggest hope that I have, the biggest hope that I know my colleagues have, is you, my friends. You are the answers. So let's talk about you for a bit. What can you do? In 20 years back, we were really taught in university, in college, and at our postgraduate that pick a disease number one, in humans, trypanosomiasis, sleeping sickness. How do we treat it? And I'll go into research to find what medicine works. And meanwhile, trypanosomiasis is a problem in cattle, and tsetse is a vector, and all those details. So that's how we were taught. Most of us are specialists in one disease, horizontal, and in humans, vertical, or in animals. You guys are already being taught that disease is a multifactorial element, and you're taught disease from a human point of view, and we add animal, tourism, environmental components. But we need to go beyond that. It has to be personal. Disease has something to do with what you do every morning when you wake up. If you don't brush your teeth, the champion has not brushed their teeth, and you go around the world giving them solution from that disadvantaged point. The collective responsibility starts with you and you alone. You must be concerned, you must be responsible, and you must be motivated. So what is One Health? What action needs to be done? You are the change makers. You must take responsibility within your sphere, within your area of influence, within your course, within your school program, and you must be willing to find the answers, because those answers are the ones that will change the world. The entire world is depending on you. Diversify, think widely. You must understand that the meat you eat comes from an animal. The animal is produced. There's animal health care. It must be your concern how those animals are treated. You must be willing to share the resources that you have with those animals, because if the animals are sick, they'll give you meat that is not good. And if meat is not good, it is going to cause disease. If you are sick, we'll be losing precious time, because you, the champions, you, the future leaders, need to spend all your time finding solution to this problem. So I will apologize because I didn't define One Health. I will apologize because I didn't use much of my professional competences in animal health, pathology, drug development, drug regulation, to bore you with that, because you're going to learn that eventually if you have not already. I decided to motivate you to know that you are the answer. The world depends on you. When you're in Zambia, there was an election a few days ago, and we voted for change. People voted for change. The change is you. You need to take action, because as long as you are not taking action, we are going to vote for change while antimicrobial resistance grows. We are going to see 10 million people die every day of resistance, and the bacteria does not stop. The viruses don't stop. The fungi does not stop. Theirs is to mutate, change, and survive. And we need to learn from them, and we need to act very quickly. I'm going to end there and allow you to ask questions. If my presentation did not meet your expectation, please ask a specific question, and I'm going to try and answer it. But that is what I felt really strongly upon my heart to motivate to you. Behavior change is the ultimate in every area, in every sector, in everything we do. And most of our systems are broken, both in Africa and in the West, in the rest of the world. Nobody should cheat you that they are very functional systems. We have supercomputers, we have super systems, but most of them are broken. Most of them are inadequate. And so we need innovative solutions. And those solutions come from changing how we do the little that we have to do today. And that change depends on you, my friends. Thank you very much.
Thank you so much, Dr. Emmanuel, for that very excellent presentation. We're actually glad we are recording this because I'm sure it will be very good for reference for the students, some of which failed to attend the session. It was really loaded with a lot of information, right from urbanization, the socio-ecological dynamics, how they impact on our health. Very, very informative and good presentation, and motivating the students, especially that we depend on them. And the bags are not waiting to get a degree like them. That was quite interesting. Yeah. So I'll just check with my co-moderator, Daniel, and hear whether there are any questions via the chat. I think I can see a few. Daniel, you can help me with reading out any questions.
Hello. Yeah, thank you, Julian. Thank you so much for the wonderful presentation. I really do appreciate. So yeah, I can see one question from Ibrahima, and he's asking, based on your experience, Dr. Kabali, what are your suggestions on the actions that students can take on tackling AMR?
Great. So that's a very simple question for me to answer. Julian mentioned, and Mefin too, that you guys are doing research. And again, pardon me, I know some of you might be at undergraduate level, some of you at graduate level. I remember when I started my postgraduate studies in the late 2000s, I was really impressed to find a disease, a specific research topic. And actually the clear words were, find a fundable topic, a topic that someone is interested in funding. For my master's degree, I did One Health at the Wildlife Livestock Human Interface. And there was no funder there. So I had to fund myself from my monthly earnings. So I did a master's degree. It took me 5 years instead of 2 years because I was paying for it 100%. That is called motivation. You must be convinced about what you want to do. Another example I'd use at undergraduate in first year in Zambia, I don't know about the rest of you in your universities, but there is what is called natural science non-quota study. That is first year. Everyone enters through one portal before you specialize into your streams in medicine, veterinary, agriculture. One of the key things we were taught to depend on was called crooks. Crooks basically is results to lab experiments and to tests which previous classes had used. And they said the lab experiments don't work. You need crooks to get the correct answers, because when you do your experiment, you will not get the answer. And that is part of the core challenge for Africa, because already education is not working at that point. So for you, you need to be convinced with what you're doing. And you need to be motivated enough to actually fund yourself if that is what it is going to take. Because now 12, 13 years down the road, I present about One Health, and in the back of my mind, I'm proud because I know I'm a champion. I paid my way to knowing what One Health is. I paid my way to where I am today. You must be that motivated and that convinced about what you're doing that you're able to pay the price for it. And it's not easy. It can be quite tough. So don't go for the easy things. Go for the hard stuff. Dream big. Dream big. Dream big. Predictive medicine means you need to be able to predict what someone will be sick of 20 years from now and do something now to prevent it. It's so impractical. But I challenge some of you to try and major in that. There's a lot of molecular science. There's a lot of research work involved. But it's a very important area. And if you guys can convince yourself, that's what I'm going to do. They'll tell you there's no money in medicine. But well, medicine makes the world go round. Are you convinced that you are in the right field and you're going to offer the right solution? These are very hard things I'm asking and I'm telling you, but you must be convinced yourself. Don't go for easy. Go for what is right. Go for what is best. and go for what your heart tells you to go for. That is one. Once you do that, you're able to find what to do very easily and how to do it. And you have me and Mefrin and a lot of other people to support you. But you must be convinced yourself. I hope that answers that question, Julian. And Daniel, over to you. Over back to you.
Yeah, I think we'll take two more questions. Daniel, yeah, you can just read the question. Yeah.
Yeah. Thanks so much, Dr. Kabali, for that wonderful motivation. Yeah, I think most of the chat, I can just see we have good comments coming in. Maybe let me take one from Saddam. Saddam asks, also, why is it that scientists know that we have problems such as NDM1 and other superbugs, but fail to come out and alert the public? Why are we so excellent in paper than the actual practical part of it? Thank you.
Oh, great. That is a very good question. And you must have the answer there. For me, for instance, I made a choice, but it's a very simple thing. We are working in a box. I'm a scientist. And once I research and I find an answer and I get a paper published, it's Lancet, it's high impact factor. I've achieved, I get my paycheck and I walk away. But the world does not need that. That is actually failure, not science. And I know this is recorded, so I can say that again. The question is describing the failings of science. For me, science is of no use if it is not relevant to a common man and to the daily problems, which is why if you look at my definition of AMR and One Health, it is focusing on current problems. We have water supply challenges. If you do research and find superbugs, how does that apply to the supply of water today in Nairobi? That is where you guys should focus your research. And I saw a question in the chat. How do students apply One Health in trying to control AMR? Exactly that. If you're a medical student, you use water in the hospital. That water might have a superbug, and you can carry out an excellent surgery and your patient will die because they got an infection through the surgical side, through the water. That is One Health. It's very easy to do. If you're in agriculture production, the food you're giving your animals, that is part of One Health because the product of animals is going to affect human life. So think widely, never think narrow. Always know that what you're doing is much more applicable elsewhere and try to actually find that application and suggest it. Our politicians, our leaders need answers right now. And you guys should move from science of research and papers to science of research, papers, solutions, and action. Action now. Action right now. I hope that answers that question. Over to you, Daniel.
Yeah, thank you. Thank you so much for, I love how you use the different approach. And I think it's the right approach that, we are supposed to use a more realistic approach. I see we don't have any other question in the, maybe let me read one from Angoni, then I think we can proceed from then. So Ngoni starts by saying, we have heard that most diseases are naturally evolving. Not that I'm sure some of them are being manufactured in the lab by the same medical profession who advocate to come up with curative medicine. I believe there should be a balance between ethics and profession. When is this going to end? Seems like we are fighting ourselves. In your experience, Dr. Kabali, how have you dealt with such an obstacle?
A very, very practical question again. The first part of your question, bugs are evolving, yes, every single day. Human beings are some of the most slowly evolving organisms on Earth. Bugs evolve literally every day. Human beings evolve in hundreds of years, and after hundreds of years, we have not changed much. The second part, which is also potent with conspiracy and all that, is part of human nature. Your role is to find that point in between where we can be effective, because there will be no end to these theories. There will be no end to the fact that human beings are self-destructing. That's a known fact. But there's also this reality that bugs and our rivals are evolving faster than us. We need to fit in between. And it's not easy. I work in an international organization. Our organization is owned by 198 countries. And sometimes you find a simple solution, let's support countries deal with AMR, sounds very potent and straightforward, but some people will disagree. How do you deal with that? So you're right, and those are challenges you must prepare yourselves for. There's no golden bullet, there's no right answer. You need to work very hard to convince the people within your influence that we need to take action now. I therefore shelve most of those conspiracies and most of those challenges because it will take a long time to prove them. But I focus on offering solutions. Behavior change, for instance. You need to change how you think, how you act, and how you behave. You need to stop throwing litter from the car and think someone else is going to pick it. Those are realities. Those are things we can do something about to control this problem. Conspiracies, they might be there. There might be people that are intentionally doing things to destroy other people. There's very little we can do about that. If you bog yourself down with that, you're going to end up in depression and you will not be the solution we expect you to be. But if you focus on things that can actually be changed, we will definitely make a difference. Gretchen, that young little girl from Sweden, has changed a lot just by taking a step, focusing on what is low hanging, what can be achieved now. And she's been an influence. You can all be the same and you can all do the same. And we can live, very soon we can leave conspiracy to history because we did something and we changed the world. I hope I've answered that question and thank you very much.
Yeah, Dr. Kabali, thank you so much. You've answered it in quite a very, very perfect way, and I really do appreciate. I hope that we have all at least, be motivated, and at least you have learned something, and the future depends on us. And so let's start acting. Over to you, Julian.
Thank you, Daniel. And many thanks again, Dr. Emmanuel. I think you can see in the chat, it's loaded with motivated, inspired, informative, and I'm sure you have really challenged them to change their thinking, to change their mindsets, to be, and also to be the change that we want to see, because I totally agree that our generation has failed. And I think last week they were challenged to learn from history, to be the change agents. So thank you so much for this. I'll give you the floor to just give any concluding remarks that you might have. And just after you do so, I'll hand the floor to my director, Dr. Meffin, to just give any remarks that he has. Then we can excuse the two of you as we get into breakout sessions. So over to you for any closing remarks.
Thanks, Julian. And I'll pick on what you just said in closing. You colleagues need to be very cautious. I still can't believe that I left high school more than 30 years ago. And at that time, I knew I was the change the world needed. But time really flies. So it's very easy for you guys to fail, just like our generations. So take your time. It's precious. It's not waiting for you, and use it now. What you think is unattainable now will be doable soon. We'll have flying cars soon. And I grew up in the time when we were watching Knight Rider, Michael Knight with his car that spoke and flew. Those are the cars we drive now. So these things we are talking about are not imagination, they are reality. If you don't act now, you quickly find yourself 30 years from now, and you will be passing this message on. My hope is that the message you'll be passing on is we heard from our previous generation, we acted and see the change that we have brought. So happy Saturday, happy deliberation, and happy changing the world. And thank you very much.
Thank you so much for those motivating and excellent remarks. Dr. Meffin, do you have anything to say before you exit? I think Dr. Murphy, yeah, I think he has said, he has given us the opening remarks, and it's okay that we were motivated. He told us that we are the cream, the students that are here, and we are the change agents. Again, I repeat that we should always remember that at the back of our minds. So now in the chat, we'll send, Dr. Emmanuel is saying bye. Thank you again, and enjoy the rest of your weekend. Bye. So we move on to the next session of our session today. And as we said, we would want to make this as interactive as possible. The breakout sessions will be, would want you to all participate. And just like we did last time, we would want you to, when you get into your groups, you quickly decide on who will be the chair or the facilitator for each group, and also who will be the rapporteur. I think in the session that we had at the end of July, we did have a challenge with one or two groups that failed to then put in the notes correctly. I think there was a challenge with using the Google Doc and all, although it's quite a simple thing to do. If you're having any challenges, just let myself or Daniel know, or Musonda, my colleague who's with us. Now I have just posted in the chat the links for all the 6 groups. I had posted these yesterday on Slack as well. So if you go into your groups, which will go shortly when my colleague assigns us, you just, as I said, choose who will be your facilitator. And please we've got only 30 minutes for the discussions. So this should take less than 5 minutes to agree on who wants to do the facilitation and also who will do the rapporteuring. The rapporteur will be responsible for capturing the notes. And I might just say now that do not write so many things or the paragraph or what everyone is saying, but just the key takeaways from the group discussion that you'll have. So if you write those, because it will be better when you're making the presentation, which will be a maximum of 5 minutes per group, to share your screen with just the shared key points, just bullet points of the answers to the questions that have been posted. Will make it much easier, and you'll be able to, I don't know whether I should go ahead and just share my screen so that I show you what the expectation is, and so that we are just on the same page as we go into the group discussions. So here, when you get into the groups, the link will show you, like this one, I have clicked on the one for group 2. You enter in here, whoever is going to be your chairperson or facilitator, whoever is volunteered to do that, and also the rapporteur down here. And then this is just a short description of what you're supposed to do, that the person who's chairing will moderate the session, making sure every group member at least has a chance, if they not have one person or a few people dominating the discussion. And if you can share your videos, it's good for the smaller breakout groups, but if you cannot, because I know sometimes because of connectivity, it can be a challenge. So it's still okay to discuss as long as you can unmute yourself. The rapporteur will make the presentation on behalf of the group, and it should be a maximum of 5 minutes and after the breakout group discussions end. And then the question is showing here, like the one for group 2, discuss some of the existing barriers in intersectoral and transdisciplinary engagement among multiple stakeholders in the context of AMR. Then there's a follow-up question for all the or a statement that's supporting the question to help you in the discussion, so to say. So under here, you just type in the bullets of whatever has come out under this, that part that said summary of group 2 discussion. Please type below. So all you're doing is using that section to type what will be coming out from the group. I hope it's clearer, and this time we'll have all groups submitting and summarizing what they have gone through. So without wasting much time, I think we'll then will be assigned into the different groups. And when we come back, in the spirit again of having a student-led and you being very participatory, today we'll have another student. In the first session when we had breakout rooms, we had Wanjiru Mangi support us with the moderation. Today we have Gatai, is going to come in and support. And I'm very happy that Gatai, one thing some of the students would not know is he actually supports us with designing some of the flyers that we use when we are having the webinar. So he's been working hard on that, multi-talented as a pharmacy student, but he's also very passionate about design. So he helps us with that sometimes. So he's the one who's going to help us with moderating when we come back. And is there any clarification? Maybe I'll just take one question before Musonda assigns us to the groups, if there is any. Or there is one in the chat that says, how do I recognize my group? Don't worry, because you'll be automatically assigned. Just as I conclude this, Musonda will randomly assign us. So you actually see a notification on your screen, whether it's the phone or the laptop, that tells you join group 3 or 4 or whatever. So we have been randomly assigned to different groups. Yeah, so I think that does it with the questions. Over to you, Musonda, to assign us. Thank you.
Please, Julian, I was in breakout room 1. My network has been unsteady. Can I please join? Mpundu, can you please put me in breakout room 1? That's where I was before network. Hello?
All right, so welcome back, everyone. I managed to visit almost, all the rooms actually, and I saw you guys were really engrossed in your discussions. We'll hear what the rapporteurs have to say. And also I would take some feedback also at the end of this session so that we just hear whether this is something you'd like us to do and how can we further improve this interactive process. So as I mentioned, our moderator for this session is your fellow colleague, Gathai Mundia. He's a Bachelor of Pharmacy student at Kenya Methodist University in Meru, Kenya. And he's also part of the Students Against Superbugs Africa coordinating team. So he will take us through this session where we hear from the 6 groups, and we have 5 minutes for each group to present. So thank you so much, Gathai, for the support you always give to us, and over to you.
Oh, thank you, Dr. Julian. I'm happy to be moderating today. As Dr. Julian said, we will be having only 5 minutes, and the rapporteur will give us only the main points. Please try to be punctual and to make sure that you don't take more than 5 minutes. Also, as we start with group 1, may the other groups rapporteurs be ready. Okay, let's have group 1, please. Welcome. Group 1 rapporteur, the floor is yours.
Okay. Yeah, thank you. Yeah, so I think we will have to reshare the links. Thank you, Gathai. I think, Gathai, they are not able to, maybe Julian, are you able to reshare the links? So that at least they, okay, thank you. So you can go ahead, Ernest.
Okay. Good morning, everyone.
Good morning.
Yeah, this is Katerega Ibrahim. This is Katerega Ibrahim from Group 1. With this, okay, we were taking question 1, and our question was, discuss the benefits of applying a One Health approach in addressing AMR compared to the traditional segmented approaches. And these are some of the points which we discussed, that in taking One Health approach. Okay, I'm Ibrahim from Uganda, Mbarara University. Point number 1, we discussed effectiveness in achieving the fight against AMR. Using One Health approach, it brings that effectiveness in the fight against AMR. Then we also discussed, are you able to hear me? Hello?
Yeah, we can hear you.
Okay, then we also discussed there is a rise in, it raises more awareness in the various fields of human and animal health. When we take this conjoined effort, there is more awareness in the various fields, because as we see, antimicrobial resistance it's a multi-sectorial problem. So this conjointness, okay, this joining of efforts in the One Health approach, it brings more awareness. Then we also discussed there is conjoined effort in the fight against AMR, which is actually the above point which I've discussed. We also discussed the interdependence, which achieves more efforts in the fight against microbial resistance. Then we also talked about the more information which is going to be tabled, because in the various fields, for example, agriculture, human sector, we see a microbial resistance coming up, yes, but it affects them in the various ways. So more information is going to be tabled such that the fight against AMR is more effective. Then we also talked about there is the integration of activities in AMR. Also, we talked about the proper resource mobilization and distribution. This proper resource mobilization and distribution is seen by by properly distributing the resources, and also following up in these resources due to one approach. Then we went to part number 2 of our discussion. Kindly provide real case examples of successful AMR interventions implemented under the One Health approach that you may have come across or read about. So this is what we came up, that among the examples of One Health approach, you have seen vaccination programs in the various animal and human sector. That is one example of One Health approach, because we see vaccinations in humans and we also see vaccinations in animals, and all of them are targeting antimicrobial resistance. They are targeting the fight against the bacteria. Then we also see the conjoining of the various organizations to fight AMR. The various organizations have come up to fight antimicrobial resistance. For example, we see the WHO, the World Health Organization. We see the Food and Animal. We see various organizations coming up to fight these global threats, antimicrobial resistance. Then there is also a challenge which we have also discussed, that despite
Ibrahim, sorry,
the various organizations.
Oh, sorry.
Yes.
Kindly try to wrap up, because your 5 minutes are over. Try to wrap up, please. Okay, thank you.
Okay. My last point is, despite the coming up of various organizations and vaccination programs which have been put up, there is less surveillance data to follow up this global challenge of microbial resistance. And this less surveillance data still limits the One Health approach program being effective. So thank you for listening. This was group 1. And in case you have any questions or any additions, please, you can type in the chat.
Okay, thank you, Ibrahim. So Ibrahim gave a very nice presentation for their group. And if you have any question, you can just type in the chat box. And now we can have group 2. I hope you are ready. The rapporteur for group 2, the floor is yours. And the rapporteur for group 3, please be ready. Kindly take 5 minutes. Thank you.
Yeah, good morning, everyone. Can you hear me?
Yeah, good morning. We can hear you. Please continue.
Yeah, my name is Ngaboktev, and I'm a second-year pharmacy student at Mbarara University of Science and Technology in Uganda, and I'm the rapporteur for Group 2. And we're given a question to discuss some of the existing barriers to intersectoral and transdisciplinary engagement among multiple stakeholders in the context of antimicrobial resistance. Yeah, as commonly here in Africa, we have a lot of problems concerning interdisciplinary working. So the first point is there's lack of common ideologies among different sectors, whereby different stakeholders work independently instead of working as a team. Here we see like each group working independently, like the doctors are working alone, the pharmacists working alone, the veterinarians working alone, the nurses working alone. And if different ministries don't work together, the Ministry of Health works alone, the Ministry of Agriculture works alone, and this creates a barrier in this intersectorial engagement. Another thing we commonly see is lack of common knowledge among different disciplines concerning AMR. Like mostly we find the AMR knowledge is concentrated in medical school, in pharmacists, in doctors, and you see it lacking in veterinarians and other stakeholders who should be involved. So this also creates a big barrier in integrating this knowledge. And there's also lack of alternatives to tackle different problems concerning AMR, such as alternatives to medication. Like people are told to stop misusing antibiotics. So they usually ask, now what if I'm sick, what should I use? And we always lack an answer to give them. So there's this lack of alternatives to offer them. There's also conflicts between different sectors and stakeholders. An example is here in Uganda, where we see pharmacists and veterinary doctors fighting over the control of drugs of animals. The pharmacists say we are the masters of drugs. The veterinarians say the animal sector is ours. So these conflicts create a lot of problems and hinder this integration of knowledge. There's also shortage of funding to harmonize these sectors. You know that for these sectors to come and work together as one discipline, they need funding. But here in Africa, we know that funding always comes as an issue. So this also creates a lot of problems here. There's an issue of access versus access, whereby here in Africa, we know that we not only have, we mainly have an issue of access, that people don't have access to medication. So this creates problems because one gets sick, but even those medications that are on the list of World Health Organization's essential medications are sometimes lacking. There is lack of functioning among AMR action groups to tackle AMR issues. We saw that these African countries put down action plans and AMR action groups, but these action groups are non-functional. They don't work. They're just there in paper, but in action, they are not visible. And this is a very big issue. Another big issue in Africa is corruption, misuse of funds. This issue is very common in Africa, and this makes the public lose confidence in the stakeholders, because once the funds allocated for AMR activities are embezzled, people lose confidence in this sector. Training is not made interdisciplinary to involve different disciplines to tackle AMR. We had a member in our group who gave us an example of Tanzania, where different national action plan highlights the need for focusing on interdisciplinary training, but it's not yet enforced in schools. But for it to be effective, we need it to be enforced in all schools from primary level to university level. But I myself, as an example, I got to know about AMR when I reached university in my second year. I didn't know about it in my high school or in my primary. And this is also one of the big issues affecting us. And this AMR message is still an intellectual topic. It's a topic for, I can say it's a topic for the land. The local people don't know about it. It's us who have gone to school who may know about it. So there is need to make this topic the topic for the local people, for them to understand. There are also high levels of illiteracy in Africa, as you know, and with illiteracy, there is lack of knowledge. So these high levels of illiteracy make
Octave, I hope you are summarizing because your time is up. So please give us summarize your summary.
Yeah.
Thank you.
As I'm concluding, these high levels of illiteracy make the message hard to comprehend, and lack of logistical support is also common. Resources are not there in Africa. Here, like you try to disseminate the information, but you don't have enough resources to disseminate the information. So as I conclude, these are the main things hindering the interdisciplinary action to tackle AMR. And if you have any questions, you can kindly submit them to me and I answer. Thank you.
Okay, thank you, Octave, for your nice presentation. And if you have any questions for the group, you can type on the chat box. He gave some examples and they are really nice. So we can have group 3 rapporteur to give us their summary. Kindly try to take your time, 5 minutes, and the floor is yours. Thank you.
All right, good morning, comrades. My name is Omech Isaac Okot, and I'm from Makerere University, Uganda. And for our group 3, we had a question which was basing on the disposal of waste in the pharmaceutical and home environment. And the question was like, the question was asking what are the implications of poor waste management practices by pharmaceutical companies? Does this scenario correlate with poor antimicrobial disposal in homes and individual settings? Discuss. And we as a group, we discussed it and we were like, yeah, there is a correlation between these things because the industrial sector and the home environment is literally the same. Because the disposal of waste in the pharmaceutical companies will end up into the environment, just like in the home setting will. So as we dispose them off into the environment, we will see that they will be absorbed by different organisms because the ecosystem around us absorbs what we give it. And when it ends up in the systems of animals and plants in our environment, mostly in the water sources, it contaminates the water sources, maybe the swamps and wells around. Even those that put them in the, let me call it the pits. Even in the pits, we all know it can seep down into the soil and be washed into underground water sources. They will come back to our environment through the boreholes and the wells that we use to get water. And here now they come in different quantities than the ones we use. Literally that will end up still into our systems and it will aid in the motivation of the superbugs coming up and disturbing us. There was also somebody who said in our group, somebody brought up the idea of poor disposal of expired drugs. To me, literally, all my life here, I've never seen like pharmaceutical companies or drug shops disposing of these expired drugs. I think we consume everything based on the fact that we buy them in smaller quantities and you don't buy with the package. They just give you the tabs actually themselves. So that one is also a problem. And for the disposal of waste in the animal sector, let's take it for the sake of animals spraying, like spraying them to control the parasites or giving them through the drenches and they take in to control maybe the intestinal worms and so on, or intestinal infections. This will not literally be controlled based on the fact that they will excrete them into the environment. And when it comes into the environment, everyone will be like, it's just animal waste and it's manure. We ignore that the fact that they could contain superbugs or the chemicals themselves are still in there. As we all know, not everything is absorbed into the body and used. Some are absorbed, but they are not used at the end of it all. The liver or the kidney will have to get rid of them. So they will still come back into our environment. I see these 2 points correlating so much from the pharmaceutical companies and the household, basing on the fact that whatever we give out, we don't really handle them in the best way. Somebody tried to say the pharmaceutical companies incinerate. I think the incineration will work that well, but still we pollute the environment based on the fact that these chemical compounds, sometimes they just precipitate into the air, and that's pollution, of course. It is a better way of handling it than home, but we are polluting the environment still. And we can be saving the problem of superbugs, but creating another problem of respiratory problems in the community. So literally everything, the disposal of waste, as it is poor in the pharmaceutical industries, it is in home setting. We send them back, we send them into the environment, but one way or the other, through the water systems, the food systems, they still come back to us. And in case the organisms come into contact with those chemicals in different quantities, yeah, we face the effects still. As humans, we are the ones afraid of death of all organisms. So we shall face it the worst because we have the consciousness. I think that was our presentation. And if there is any question, please, you can send it forth and we see. Thank you.
Thank you, Isaac, for taking exactly 5 minutes, and your presentation was good and on point. So we'll have group 4, the rapporteur. I hope you are ready. Please take 5 minutes and the floor is yours. Thank you.
I'm ready. Can I show my screen? Am I able to present my screen? Okay, thank you. Okay, good morning, everyone. Uncle Joseph is my name. Presenting on behalf of Group 4. Idea, we're looking at intensive farming and how it has contributed, or rather the impact that it has on my antimicrobial misuse. Okay, are you able to see my screen, please?
Very well.
Are you able to see my screen?
Yeah, you can see it.
Okay, thank you very much. So the objective, we're looking at factors that has led to misuse of antimicrobials, and then also look at the implications and also the intervention. What is it that we can put in place to avoid the misuse of antimicrobials? So the leading factors of antimicrobial misuse in intensive farming. One of the things that the group came up with is that you know, one of the things is that animals are kept together, and being kept together, that alone facilitates the spread of antimicrobials. Not only that, but also increase in the use of genetically modified foods also has led to you know, misuse of you know, there is use of antimicrobials in the gelation of GMOs. Also, poor farming practices also has led to the misuse of antimicrobials. Not only that, but also the use of prophylaxis. You know, the use of prophylaxis even when there's no need, or when there's no need of using prophylaxis, and that exposes these animals, or rather these animals, to suboptimal microbials, which leads to resistance in this regards. Who doesn't understand more about antimicrobials, and this leads to resistance, development of resistance in this aspect. We're also seeing the improper disposal of waste. Since we have lack of qualified personnel, this leads to improper disposal of waste. These people know how to dispose this the waste of. Okay, we've talked about unqualified personnel downstream, but if up there we have unqualified personnel, they'll mismanage everything, which will lead to increase in misuse of antimicrobials. Now, what are the implications on the food industry, or rather on the food farming? One of it is that there's improper house or other farming products. There's also improper waste disposal, lack of biosecurity, lack of knowledge about the whole system on how to handle it. There's also lack of you know, okay, about farming out of the source. So you implication on the host itself. Altogether, that will lead to
We can't hear you well. Your audio is breaking. We lost Josephat. We lost Josephat. Maybe we can go to another group as we wait for Josephat. Maybe he can wrap up his presentation later. So we go to group 5. Please, the rapporteur for group 5, kindly take 5 minutes and give us your presentation. Thank you.
Good morning, everyone. Can you hear me?
Good morning, we can hear you. Please continue.
Yeah, this is Magin Nanambi Ruth from Uganda, Makerere University. I'm taking you through group 5. And the question was, are you getting me? Can you hear me?
I get you. So sorry, Josephat. Wait a little bit. We will have group 5 first, then we come to you later. So you can continue, Ruth.
The question was, discuss the risks posed by cohabitation and close interaction of animals and human beings in the spread of resistant microbes from animals to human beings or vice versa. And the part 2 of it was, explain how contact with animal manure contributes to spread of resistant microbes during periods of heavy rainfall and strong winds. So I'm going to start with part 1. Cohabitation with animals. This could be pets or even just the domestic animals. Sometimes deep in the villages, people even cohabit in the night with the animals, like chicken or even others. So in case of infection, these animals could directly spread the resistant strain to the humans. Then also growth promoters like colistin, tetracycline, and third generation cephalosporins. Yeah, these ones are normally used to promote growth in animals. And sometimes people, of course, people eat the animals. Yeah, this could make the resistant strains to get adapted to these antibiotics. And as the animal, as the humans consume them, they can easily pass the resistant strains. Then the water sources and the food source. The food source, sometimes you could just be cleaning or giving the animals water. And then due to poor hygiene, it could be passed through fecal oral routes from the animals that you cohabit with to the humans. Then another risk is the zoonotic diseases like tuberculosis and the common bird flu, or even the flu in rabbits or any others. Yeah, they could pass from the animals. They could be resistant, like the multi-drug resistant TB. When you share anything with the animals, just close cohabitation, you could get the resistant strains from the animals. Then during the infection treatment or control, yeah, sometimes we give prophylaxis to the animals. This could expose them to the antibiotics, and they could later on transmit the resistant strains to the animals, from the animals to the human beings. Then we have another risk of poor disposal of the antibiotics. The antibiotics, animals could graze freely. Then you find a rubbish pit anywhere in the people have disposed of the antibiotics. Yeah, animals will graze freely and they will take the antibiotics, and the bacteria that were inside them will adapt to the antibiotics, and they could get mechanisms to become resistant to the antibiotics. So I'm going straight to, that was part 1. I'm going straight to part 2 of the question, which was explain how contact with animal manure contributes to the spread of resistant microbes during periods of heavy rainfall and strong winds. Yeah, so manure is a natural fertilizer. Yeah, people normally use cow dung, even chicken droppings, anywhere. Yeah, so this manure, plants can actually take up the manure, the manure the dung that has been passed from could be the cattle. They could be having these resistant strains of the bacteria, and the animals and the plants will take them from the soil. Then the humans will consume these plants, and they will also get the resistant strains from the plants. So that is one way manure can contribute to resistance from animals to humans. Then someone gave an example of people using cow dung to smear their houses. This is very feasible because you smear the houses, and this could easily pass through the humans because of poor hygiene. Every day you enter the house that has been smeared with cow dung, and of course the bacteria could be there, which has been passed, the resistant bacteria that has been passed in cow dung. You can easily get it through the fecal oral route. Yeah. Then strong winds and rains, they spread resistant microbes from one place to another. During heavy rains, the rain splashes. So when you find manure or dung anywhere in the compound or anywhere like vegetables have been grown, the cow dung, the resistant bacteria which is in the cow dung can easily splash into the vegetables. When you don't cook it well, you can easily get the resistant strains from the bacteria. That is the end of my presentation. Thank you.
Thank you so much. I think we have lost Kathay for a while. So yeah, at least maybe if you have any question on the presentation, you can share. What motivated the question was for us to see how such things, especially even extending to construction, farming practices such as milking. And also there was a study done that also showcased, during wind period, some of this manure can be blown off, and some of these airborne bugs, you can also maybe contract them. And as Saddam shared in the chat, we also have to look at the vice versa. What are some of the diseases that humans have that they can also transmit to animals? So without taking much time, I would love to invite Gozi back. So if you're there, you can just share so that you sum up with group 3 presentation, then we can go over to group 4. Yeah. Sorry, group 5. So are you there, Ian? Okay, we seem to have lost him too. So maybe am I audible? Maybe someone can confirm, please. Can you hear me?
Yes, we can.
Yes, we can get you, Daniel.
Okay, thank you, Brian. So we can now go to group 5. So please, we'll be sharing the presentation for group 5. You can go ahead. Let's try to keep our 5 minutes so that at least we don't overstretch too much. So over to group 5. Thank you, our rapporteur.
I think now it's group 6. Yeah.
Group 6. Sorry. I seem to have. So group 6, please, you can go ahead.
All right, thank you. Good morning, everyone. My name is Naiga Winnie. I'm from Bra University of Science and Technology. I do pharmacy and I'm in my year 2. I'm here to present what we discussed as group 6. Our question was, antibiotics are used in plants to control certain bacterial diseases in high value fruits, vegetables, or ornamental plants. Discuss how these practices could contribute to spread of antibiotic residues and resistant microbes to humans, animals, and the environment. That is part A. And then part B, explain the implications of these practices on food safety in context of antimicrobial resistance. So basically, when we were discussing this particular question as a group, we discovered that it mainly focuses on the spread of resistant microbes and antibiotic residues from plants and animals to humans and to the environment as a whole. So for part A, where we are discussing how these practices could contribute to the spread of antibiotic residues and resistant to humans, animals, and the environment, this is what we came up with. So when the antibiotics are used in animals and we do not wait for them to be eliminated from these animals, we end up consuming the antibiotic residues and the AMR bacteria from the animal products. And then another thing, humans are the ultimate consumers of plant parts and animal products. So when we use these antibiotics in animals and plants, we end up consuming them. So basically everything is about consumption of the fruits, of the animals products, and of the plant parts. So another thing is the mode of introduction of the antibiotics to the plants, for example, irrigation, spraying. So in the process of introducing these antibiotics to the plants, some of the antibiotics may end up polluting the environment, because in the process of spraying, you're not really just spraying the plants, you may end up also spraying the soil. So you end up exposing the microbes to these antibiotics, and thus resistance. Also, the fecal matter of the animals that consumed the antibiotics, in case of excretion, it can also introduce the antibiotic residues and the resistant strains to the soil and to the environment as a whole. And then in case it rains, the antibiotics on the plants may also be washed off, and it may end up in water streams, thus water pollution and exposure of the water microbes to antibiotics. Then when some of the parts of the plants fall off, for example, the leaves, they will decompose and the antibiotics will be introduced to the soil and to the environment as a whole. Then the next part, which is explaining the implication of the practices of food safety in context of AMR. So basically, food must always be eaten and we depend on food. And the use of these antibiotics in food will just intensify the problem of AMR, because we must always eat the food. And most of these plants, for example, the high value fruits, the vegetables, or the ornamental plants are really not cooked. People just wash and eat the fruits. So if we keep on using the antibiotics in plants, we shall ingest the exposed plants and thus worsening the antimicrobial resistance problem. Thank you. In case you have any additions or questions, you can post them in the chat and we keep on discussing from there. Thank you.
Yeah, thank you so much, Winnie. Is Ian just so maybe group group 3, maybe can you maybe wrap up? Is there maybe someone else who can present? or maybe Josephat, you can go on.
Yeah, it was group 4, right? Yeah.
Oh, group 4. Okay.
I'm part of group
Okay.
4.
Okay.
Let me just present and wrap up.
Okay, okay, yeah, you can just wrap up. Sorry, I'm kind of confusing the groups. Apologies for that.
Okay, so are you able to see my screen?
It's still sharing. I think we'll be able to see it with time. Maybe anyone else who's seen the screen? Maybe my, okay, it's not visible. Yeah, so you can just wrap up, please.
Okay, so during the interventions where intensive farming is concerned, so one of the things that we talked about is implementation of infection prevention control, so that this would help reduce the misuse and of course prevent the rising of antimicrobial resistance. Not only that, but also biosecurity, biosafety procedures. If these are properly implemented, will also help to reduce the other factor is awareness, of course, advocacy and awareness of AMR to these farmers who are involved in intensive farming. When they are aware of the implication of the misuse of these antimicrobials, they would be able now to take a positive stance in terms of reducing the misuse of these antimicrobials. Hence, reducing the emergence of AMR. But also, this also includes education. In awareness, we also also inclusion of education. When you educate these farmers on how to go about it, how to give these antimicrobials, how to how to dispose of, we educate them on how to dispose of the waste disposal, on how to dispose of the residues, the antimicrobial residues. You'd find that would increase, would reduce the misuse of antimicrobials, but also putting in place the regulation of antibiotic access. Because if these regulations are put in place where we have pharmaceutical regulation in place, where we have debates who are put in place to ensure that the use of antimicrobial in this case is properly monitored. Not that there will be a reduction in misuse of antimicrobials, but also where we now promote animal vaccination instead of promoting mostly the use of antibiotics. We now promote the vaccination of animals. This will lead to less misuse of antimicrobials. Other possible intervention also include reduce or rather reduction of prophylaxis. Prophylaxis might expose the animals or rather these farm products to suboptimal optimal drugs, which might lead to were not misuse. If we improve on good farming practices, it would mean that we're reducing on misuse of antimicrobials. Also, we need to, what we discuss with the group is that policy implementation. Sometimes we can just have the policies. I think as Martin and others were talking about the action plan. We need to move from action to action. So action now, we need to implement these policies to implement them so that we reduce the misuse of antimicrobials. Also, proper veterinary care. Not only that, but also strengthening this. you find that when you go into the vet industry, or rather the intensive farming the industry, you find that there's low or rather almost none in terms of surveillance of antimicrobials. But if we strengthen the surveillance, we know we have the data of what is pertaining on the ground, we'll find that we'll be able to reduce the misuse of antimicrobials, because it's this data that we'll get from surveillance, which will help us to inform and educate the farmers. Also, what we are seeing is improve also, or rather we take up the One Health approach, okay, which would include the animal health, the human health, and also the environment. In so doing, we'll be able to reduce the misuse of this. But not only that, but also the quality control improvement. This quality control improvement will help us to monitor and be able to monitor what is really pertaining, and also improve on the gaps that we might have identified on the proceeding or on the ground. So thank you so very much. This was our presentation. Thank you very much.
Thank you so much, Josephat, and also for taking your time to prepare that PowerPoint presentation for us within that short time. We really do appreciate. Yeah, and it has been a wonderful session. At least we had a motivation session as we started off from Dr. Emmanuel, and we went to breakout rooms and we discussed. As Julian shared, we'll be capturing some of your feedback to see how well you think we can maybe, improve the breakout sessions so that at least they are more impactful. I've also talked with some of us, and at least they have shared good feedbacks that we could also utilize. So I'm sure that many of us do have some good feedback. Yeah. Maybe let me give you a piece of my rhetoricals that I love giving us as we complete the session. And today I'll offer a small story on something that Dr. Emmanuel shared about predictive approach, to predictive medicine, or predictive approach of curbing diseases. So early this week, I happened to attend a conference in Nairobi. Julian was with me there, she can attest. And in one of the presentations that we saw was there's a program that FAO, that is Food and Agriculture, FAO has developed, and it's kind of trying to predict the cases of Rift Valley fever in Eastern Africa. And it has a lot to do with geospatial engineering, a lot of NASA work, space and everything. And it was quite a good presentation. And I'll come to the point why I'm sharing this, that at least you're able to relate with it. And the person who presented this presentation, he was very elaborate, he was very, comprehensive. He really understood the subject matter very well. And you could even say that he has done some geospatial engineering or something. So after the session, I got to talk with him, and fortunately, I got a free ride back home. And as we were kind of going back home, at least it was coming from the side that I was coming, so we were able to chat. And I kind of wanted to know more about him, because he was very, very coherent in terms of even the terms that he was using. And it may be a surprise, but he studied as a veterinarian here in University of Nairobi. And he was telling me that over time, he has been able to master the concept so much well, especially in terms of geospatial items and everything, such that he's able to loop in, and he did a master's in pharmacology and toxicology. So he's able to bring in the drug aspect, he's able to bring in the veterinary aspect. He has gone for some training on geospatial, and is able to kind of collate all these knowledge with also input from other professionals and develop something good. And his name is Dr. Mark Nanyingi. You can go and search him through. And what this reflected is it showed me the potential that we as students possess, you know, as it was shared earlier by Dr. Emmanuel, such that today you may be, you know, you may be studying maybe for pharmacy or veterinary, but if you're able to kind of go beyond your kind of imagine wide, you can even come up with things that someone would hear you presenting, and if you told them your background, they wouldn't even believe. But all this will be motivated maybe towards a better healthcare system, or even specifically towards maybe developing some interventions on AMR. So we have the potential and we can do much. One of the pointers that I would love us to look at maybe was as the presentation was being done on, you know, the poor waste management practices in pharmaceutical companies, and also the poor disposal in our homes, and also a lack of good protocols in community pharmacies. And we would think around, as the presentation was going, I thought, so what can be done? And one of these is that some of these drugs don't really have to reach to, you know, to the expiry date. It has a lot to do problems with inventory and everything. Those who have worked in the community system, you know that there's a way that you can kind of organize your inventory such that you know, fast in, fast out. But then, you know, we have kind of these confusions or anything. So these are some of the, you know, innovations that we may think around. I don't know how people dispose the antibiotics at home. That is if you have leftover, and I don't know why we would have leftover if we adhered to the dosage anyway. But I don't know, maybe you can share how do we dispose leftover antibiotics at home? You can just share in the chat box so that we see, you know, these are gaps that exist. And, you know, if many of us then take antibiotics, some of us maybe dispose them in the garbage bins or anything, and they end up in our soil. So the last thing, so that I don't take much of our time, is in the questions, unfortunately, we were not able to share something on urbanization. But as Dr. Emmanuel shared, urbanization it's quite, you know, it also brings in the intricacies of One Health. And I would love to point out to, you know, urban informal settlements. There's an article that was done, I think I shared with us, by New York Times. It was kind of a case study in Madare. I would love us to go and look at it. I think I'll reshare it again. And you look at how these different factors all contribute to, you know, the rise in AMR. It has a lot to do with even poor sewage systems and all this, you know. So just go look at it. Also, you know, the issue of healthcare financing is still there, still affecting AMR. So yeah, so thank you so much. Thank you for making time to attend today. I think Julian will share with us the updates of how it go on, maybe the next session and for the month. Yeah, so thank you, Saddam, for that. So thank you so much, and yeah, let's have a wonderful weekend. Thank you.
Thank you so much. Thank you so much, Daniel. And indeed, this has been such a great session. I love the model that Dr. Emmanuel used, the way he presented, more of challenging us to act, because as Daniel said, there's a lot of wealth of information amongst even just this group that is here. The chat has been very lively today. I can see a lot of comments. He picked on the one for the disposal of expired medicines, not just the antibiotics, but even the other medicines, how we are disposing that. And I think that leads back to lack of awareness, where most people do not even know the impact of a small action. That, okay, the chemicals that are in these leftover drugs that I'm just disposing without thinking have then effect in the environment, which will come back to haunt me. The manure practices we talked about, where people just, even the cohabiting with the animals. So there's been a lot. I'm really glad that we are recording these sessions, because I think even as you transit to your professional careers, it will be important to just go back. Here, that session that motivated me when there was that speaker talking about how the generation has failed and how we can change, what can we do? I think there's been a lot of challenging, the challenging of the mindset is what's important. Because if we look at this, contrary to what some of the experts assume, that students maybe do not have the knowledge, maybe we don't even know what One Health is, but I think from what I'm seeing as the sessions are going, so even today, if you look at what came out from all the groups here, very, very rich discussions that went on. Of course, because of the interest of time, it was 5 minutes, so very compacted, but I could see a lot of great points that came through. So the key challenge is, what do we do? How do we act on this? Let's not be like, let's learn from the history of people knowing, because we've got the information, but what are we then doing? Are we researching more? What are we using? Our areas of interest, like Daniel has shared that case of the doctor who then is very interested about, he gave a very good presentation about how they are tracking Rift Valley fever in the East African region. And it was very informative. I actually learned quite a lot, how they go use NASA, then use the technology, geospatial technology to come up with they'll be actually tracking which are the red regions, what interventions can they do? Is it practical to vaccinate animals in certain areas? What is the population of the animals? What cases have been identified, etc. So it was an interesting one. And what also came out clearly in that session was the complexity of working together. This was an event hosted by the Kenya Animal Health Network. And the reason why they formed this network was really because in Kenya, the organizations working in animal health, this is just one sector, were very disjointed. They had no idea what their fellow partners were doing, what projects were being implemented. So there was a lot of duplication, a lot of parallel interventions going on. So they formed this network, and you can imagine even within the network, they are still trying to set up structures, but this is just for animal health. So you can imagine when we cross over now to put the human health, environmental, it becomes very challenging. But we are happy to note that all these challenges are being brought to you at this stage, which in my opinion is relatively timely, so that as we go into our professional careers, we are very aware of what the challenges are and what we can do. In the same realm, I think a lot of research ideas have come through. If you look at even what has come out from the groups, what is being discussed in the chat, it will be interesting to hear maybe one student, say from Uganda, has done a paper or published a paper that shows how antibiotics or how other medicines are being disposed from the home. And maybe you never know, this can actually influence policymakers to do something and also come up with ways of raising awareness, because most of it is just doing without knowing. You just throw in the bin and you think you're done and you're not affecting anything, not knowing what impact that has, maybe even to the water that you drink tomorrow. So with that, I think we've got so much to talk about. We've got so many things to reflect on, but going forward, let's just continue the discussions. Let's continue. We will post even more links on the Slack channel for us to just go through. There's also a very interesting article that I found, although it was published in UK, but it was talking about the systems map of how everything interlinks together, which we already know about and which we have been told today, even the issues of urbanization that have come through. I think it will be important to continue, and most key, look at what you can do, like even currently in terms of research or the interventions. Anything small, baby steps are better, and the low-hanging fruits. So going on, next week, we do not have a session. This is our last session for the month. I think we can take a break from the sessions next week. But on the 4th of September, we'll look at antimicrobial stewardship and IPC. We'll look at both in human health and also biosecurity measures in the animal health space. We will share some links for you to go through, and also just research around AMS, IPC as we lead into that presentation on the 4th of September, where we'll have some experts come to share their insights. So, and as Daniel mentioned, Please feel free to suggest ideas. As we said, the hope is with you. I think Dr. Meffin said you are the cream. You are the ones we are relying on. Dr. Emmanuel mentioned a number of times how Africa depends on the ideas that are coming from you. So very happy to be having such a group of committed students. Even just the fact that you are here this Saturday morning speaks a lot, as I always say, that commitment to wake up and say, okay, I want to log into this session. I want to learn more about AMR. So let's not spoil it by just hearing, learning, and doing nothing about it, but instead let's continue to work. And I would like to appreciate all of you, and even the students that are doing a lot of work behind the scenes. We've got some that are helping us with rapporteuring the sessions. And today, well done for all the group discussions. Thank you to the chair, all the people who chaired the groups. A very short notice, but you volunteered to do so, to facilitate. The rapporteurs who all did an excellent job. Even group 4 went ahead to come up with a presentation under very, very short notice. So these are some of the things that really show their your level of commitment just by being here. And as we move on to the next months, I think, as we said, we'll be tracking who attends the sessions. We'll also be tracking so that at the end of the day, as we said, we want to know the percentage attendance that is there. So as we go forward, we'll continue doing that. And thank you so much. I'll give I'll open the floor to just any questions that you might have, maybe 2 as a maximum. And also, Daniel, if there's anything you feel we need to add. Alex has a question. Please go ahead and ask.
Yes, good morning, everybody. This is Kaka Alex from Uganda. First of all, I want to appreciate the session that we have undergone today. And I just want us to not to forget about God. The reason why I raise my hand is just to pray, so that what we have had today, we put in our hearts so that we fight the MR in our community. So let's pray. God Almighty, we thank you very much for keeping us alive up to today. We thank you very much for giving the knowledge to our facilitators, to the students, to everybody who support us. May you guide us. May you give us the strength, the joy, the happiness, and the faith to work hard in this fight against AMR. People are dying silently because of this. So I ask that we give glory to God, and may He guide us as we depart now to our places where we work and where we stay. Could you guide us? Give the student the knowledge to continue fighting this. I ask this through Christ our Lord. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you so much, Alex. And very, very important to always remember to thank God, to ask for the divine intervention as we seek knowledge, as we also seek for wisdom and strength to make sure that whatever we have learned, we are also actualizing it, and we are also doing the best we can in our settings. So thank you so much, Alex. Excellent comment, and thank you for the prayer. Arnold?
Thank you, Julian. Mine is not a question, but I wanted to give some supplementation on some terms which we have been using. Actually, this month 1, there are some 2 things that came into my mind. It was about the zoonosis and the reverse zoonosis. And actually, I've observed that most of us, we use it, but we tend not to know the whole concept. The zoonosis actually is kind of very clear, because most of the diseases can easily, if they are passed on to humans, we can easily see the impact. But the reverse zoonosis, on the other hand, where humans can be able to transmit infections to animals, is still raising debates, because even the diseases which are currently under study by WHO, when we look at the Staphylococcus aureus with the skin infections, the Cryptosporidium with the diarrhea infections, still their pathogenesis to cause this a disease, to cause disease in animals, if vis-a-vis the animal causing a disease to human, is still under debate. So those areas, they kind of raise questions whether a human can actually directly infect an animal, yet in the sense of science, influenza H1N1, which was an evolution of the swine influenza, but you find that studies, they are still even failing to bring out the reverse zoonosis, which is thought from humans to animals because of the high spread from from country to countries. So this reverse zoonosis is kind of still a contentious term to still use, or to ably say that a human being can actually cause disease to animals. The other concept which came to my mind actually is antibiotics and antimicrobials. Yeah, I met another school of thought where antibiotics actually, when we say antibiotics, we are not limited. It was terms means living animals, and as such, antibiotics, it would mean that all drugs which are directed to a particular living animals, because abiotic, it means a non-living animal. So, but in our studies, we are so much focused that antibiotics kind of limited to bacterial infections, and still, to my mind, the literature is there and trying to sort out those two lines. Thank you.
All right, thank you so much for your comments, which are really excellent. It's good to see the upcoming students that are working on animal health actually provoking, because this is now going beyond challenging our brains to think ahead. I think you agree with me that I think over 70% of the emerging infectious diseases have their origins actually in the animal world. This has been proven in a lot of researches that have been done. But you brought about the interesting aspect of the reverse zoonosis. Now, to say what are the humans also contributing the reverse way to the animals? And I think this, my comment, which I'll leave for if there is anyone else who would want to comment, would be, I look at that as a very interesting research area that students, including the ones that are actually represented here today, can actually look at and also try and find out how you can further research in it, so that you look at even what has been published around that, what are the current researchers saying, where are the research gaps, so that we can focus on this as part of our thesis or even as a way to go forward. And it's also interesting that you brought this up, because we also would want to invite a very passionate veterinarian in one of the sessions in September, where you also shed light on these zoonotic diseases. Is an expert in that. He was actually the one convening the meeting we talked about earlier, where they were looking at the Rift Valley fever and transmission of that disease, and what are the current trends now. So that's what I would comment there. I don't know whether there's anyone who wants to comment at the moment, or we can take the discussion even as we have the expert who look at the zoonotic diseases. Is there anyone with a comment? Maybe in the chat. Okay.
Yeah. I can see some comments
Yes.
in the chat, Julian.
Uh-huh.
We have Saddam and Ibrahima sharing something about bovine tuberculosis. Yeah, so I think Saddam and Ibrahima, you can explain to us more. You know, you are animal experts in that, and also the rest of our animal health colleagues in the session, and so that at least we also have a clear understanding. Yeah. So the issue of antibiotics, I think I saw it once more in the group on the definition of antibiotics. Is it just are antibiotics just antibacterials? So let me give you my thoughts on maybe what we were taught in the pharmaceutical chemistry class. But I think next session, as Julian said, we'll have 2 experts. That will be on 4th September. We'll have an expert in animal health, and he will kind of now give us more information on a deeper angle on animal health. And we'll also have another expert on human health, especially in the context of antimicrobial stewardship. She has done so much. And so these are some of the questions that we can ask during the session, because the two are good experts. So for antibiotics, I think the term antibiotics, when it was coined in the development of penicillin, what happened, antibiotics are drugs that are developed from, as you can say, biotic, from a living organism, be it maybe other bacteria, be it a fungi, be it, these drugs that are not synthetically developed. Yes, you have the original one, maybe from the living organisms, but then you kind of have to modify, just like some of cephalosporins and everything, to account for some of these side effects and some of maybe improve the efficacy and all that. So but now what happened is that you realize that most of the antibiotics that were being developed, they were so much potent in against bacteria. Kind of it was more aligned to bacteria. So I think that's where now the convergence came, whereby antibacterials were then kind of now aligned to antibiotics, because most of the antibiotics that exist are antibacterials. But then that doesn't mean that we have some of these antibiotics that are not antibacterials. Others have multiple uses. But then I think that's a general consensus that has been taken in the science field to refer to many of the natural antibacterials as antibiotics. But you also realize we have also some antibacterials which are synthetic. So these are, these are more of a technical discuss, but these are some of the questions we might ask. So back to the session, I wanted to remind us, for some of us who are quiet, to share reflections. Please, let's do so. Let's share reflections. I also shared a very comprehensive, it's kind of a link, it's kind of a journal paper, but I realized that it's a book, as there's the one that I shared with also the React write-up on animal health. Please go through it. It's very rich. I've tried going through it, and it also brings out some of important aspects. So all the best. Thank you once more for joining. Thank you to our facilitators today, our rapporteurs, our group leaders, you in particular, Agadai, Julian, our guest in absentia, and some of us working in the background. We have Michelle and Anastasia. So thank you and have a wonderful weekend. And as you've been told, don't just stay with the knowledge. Let's engage. Thank you. Over to you, Julia.
Thank you, Daniel. And apologies for taking longer today. I think there were a lot of interesting discussions which can also go forward. So mine at the moment is just to say thank you and not dilute all that has been said. And please feel free to engage. I continue repeating, I would want to see more traction in Slack. I would want to see more comments. Even now we've got issues of coming in with animal health. Please post that in the Slack, so that even as because we've got a lot of experts that really want to build your capacity, that are willing to help. Like you saw, Dr. Emmanuel, very passionate. He's a veterinarian who's very passionate about animal health, about One Health. So if you have issues, even when you want to do your research, you need some guidance, you need some feedback, you need just to have something. They are very, very willing to do so. And as I have always said, if you do post it in the Slack, it's better to track We can then give feedback there. If you feel you want to drop an email, well and good. You can also reach out to me and I can connect you with someone who will be able to at least respond to your concern that you're having as you maybe try to carry out research or their concerns that you have. And thank you, Daniel, for also addressing the issue on antibiotics and antimicrobials. And there are a lot of materials as well. The online course also shed light on that, on the difference and all. And please feel free to continue engaging, continue revisiting all the resources that have been shared, and just read some more articles. So thank you so much. Enjoy the rest of your weekend. We'll catch up on Slack and WhatsApp, and also now at the session on the 4th of September. So thank you so much, champions. Bye.
Bye-bye.
Bye.
Bye.
Thank you.
Bye. Thank you very much.